Why ICU uses fentanyl instead of dexmedetomidine or Precedex for ventilated patients with pneumonia. My name is Patrick Hutzel from intensivcarehotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, control, power, and influence, making sure your loved one always gets best care and treatment, even if you're not a doctor or a nurse in intensive care. So today I have an email from one of our clients, Brett, who asks, "Hi, Patrick. Just chasing up some questions about fentanyl. Why are they using fentanyl and not dexmedetomidine? Dexmedetomidine is also known as Precedex. Would there be any reasons? Does dexmedetomidine have a better profile regarding spontaneous breathing metrics? Why would they use fentanyl if she's in ICU ventilated with a breathing tube for pneumonia? Especially when we're trying to avoid the tracheostomy, and she's been ventilated with a breathing tube for 25 days now, trying to extubate her. Best wishes from Brett." This is obviously an excellent and very relevant question for many families in ICU, especially when it comes to long-term ventilation, sedation, and weaning from the ventilator and the breathing tube. So, fentanyl versus dexmedetomidine in ICU, what's the difference? Fentanyl is obviously a powerful opioid painkiller that is often used in ICU for pain management and sometimes as part of the sedation regimen. It acts quickly and provides deep pain relief, but one of its main side effects is respiratory depression, meaning it can suppress breathing and make ventilator weaning much more difficult. Dexmedetomidine, also known as Precedex, on the other hand, is a sedative that allows for lighter sedation while maintaining spontaneous breathing. It acts on alpha-2 receptors, not opioid receptors, and patients on dexmedetomidine or Precedex are often more awake, more cooperative, and easier to assess neurologically. This obviously makes dexmedetomidine ideal for ventilator weaning and extubation because it supports patient comfort and calmness without suppressing their drive to breathe. So, why is ICU using fentanyl instead? There are several possible reasons. Number one would be pain management. If your mom is experiencing significant pain from pneumonia, some procedures, or prolonged intubation, fentanyl may have been started primarily for pain control, not sedation. Number two, ICU protocol or habits. Some ICUs have standardized sedation protocols using fentanyl and midazolam rather than dexmedetomidine or propofol. Unfortunately, this can be a one-size-fits-all approach, often delaying ventilator weaning. Number three, cost and familiarity. Dexmedetomidine is more expensive in the short term, and some ICU teams are less experienced or less comfortable using it. And number four, unclear sedation goals. In many ICU, sedation is clearly overused. Instead of targeting light sedation to promote weaning and extubation, patients are kept deeply sedated, which delays recovery and can lead to unnecessary and preventable tracheostomies. And also with pain management, for example, there may be no pain management needed if you're moving towards extubation or if you're moving towards a tracheostomy, if there is potentially no other option. So let's keep it moving here. Does dexmedetomidine or Precedex have a better profile for breathing metrics? Yes. Dexmedetomidine or Precedex supports spontaneous breathing, reduces the need for opiates and benzodiazepines, and allows for better neurological assessments. It can significantly improve the chances of successful ventilation, weaning, and extubation. In a patient who's been ventilated for 25 days with pneumonia and the breathing tube, and where the goal is to avoid a tracheostomy, switching to dexmedetomidine could absolutely help, provided the patient is hemodynamically stable and there are no contraindications. So, what can you do next? You should ask the ICU team, what's the current sedation goal? Why are they using fentanyl and not dexmedetomidine or propofol for lighter sedation and easier weaning? Can they trial dexmedetomidine to assess breathing and neurological function? You should also insist on a daily sedation interruption or also known as sedation vacation, or spontaneous breathing trials if the goal is extubation. And this, once again, goes hand in hand with what I've been saying here for over 10 years, that the biggest challenge for families in intensive care is that they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights, and they don't know how to manage doctors and nurses in intensive care. That's exactly what Brett is dealing with here. Imagine Brett would have had that information on day 3 or day 4. His mom might be extubated already. In summary, but it's never too late either. We can always help you here. If your loved one has been ventilated for over 25 days with pneumonia, the goal is to extubate without a tracheostomy. Fentanyl is not the best choice, most likely for sedation. Dexmedetomidine or propofol can facilitate spontaneous breathing trials, faster weaning, and better neurological recovery. Always remember, you have the right to question and influence sedation and weaning strategies in ICU. If you need help with ventilator weaning, sedation strategies, avoiding tracheostomy, go to intensivecarehotline.com and we can help you from there. Contact us at intensivecarehotline.com. Why ICU uses fentanyl instead of dexmedetomidine or Precedex for ventilated patients with pneumonia. My name is Patrick Hutzel from intensivecarehotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, control, power, and influence, making sure your loved one always gets best care and treatment, even if you're not a doctor or a nurse in intensive care. So today I have an email from one of our clients, Brett, who asks, "Hi, Patrick. Just chasing up some questions about fentanyl. Why are they using fentanyl and not dexmedetomidine? Dexmedetomidine is also known as Precedex." I have worked in critical care nursing for 25 years in 3 different countries, where I worked as a nurse manager for over 5 years in intensive care. And I've been consulting and advocating for families in intensive care since 2013 here at intensivecarehotline.com. And I can very, very, very confidently say that we have saved many lives with our consulting and advocacy because of our insights, and you can verify that on our testimonial section at intensivecarehotline.com, and you can verify it on our intensivecarehotline.com podcast section, where we have done client interviews. And because our advice is absolutely life-changing, right? The biggest challenge for families in intensive care is simply that they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights, and they don't know how to manage doctors and nurses in intensive care. And that's why we help you to improve your life instantly, making sure you make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment always. And that's why you can join a growing number of members and clients that we have helped over the years, saving their loved ones' lives. And that's why I do one-on-one consulting and advocacy over the phone, Zoom, WhatsApp, whichever medium works best for you. And I talk to you and your families directly. I handhold you through this once-in-a-lifetime situation that you simply cannot afford to get wrong. And when I talk to families directly, I also talk to doctors and nurses directly, asking all the questions that you haven't even considered asking, but must be asked when you have a loved one critically ill in intensive care. I also represent you in family meetings with intensive care teams. We also do medical record reviews in real time so that you can get a second opinion in real time. We also do medical record reviews after intensive care. So if in case you have unanswered questions, if you need closure, or if you are suspecting medical negligence. We also have a membership for families of critically ill patients in intensive care, and you can become a member if you go to intensivecarehotline.com, if you click on the membership link, or if you go to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in a membership area and via email, and we answer all questions intensive care related. In the membership, you also have exclusive access to 21 ebooks and 21 videos that I've personally written and recorded. And all of that will help you to improve your life instantly, make informed decisions, have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment always. And all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com with your questions. And if you like my video, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, Share the video with your friends and families and comment below what you want to see next, what questions and insights you have from this video. I also do a weekly YouTube live where I answer your questions live on a show, and you will get notification from the YouTube live if you are a subscriber to my YouTube channel, or if you are a subscriber to my intensivcarehotline.com email newsletter at intensivcarehotline.com. Thank you so much for watching. This is Patrick Hutzel from intensivcarehotline.com, and I will talk to you in a few days. Take care for now.